Hello, everyone. My name is Dr. Meagan Medley, and I'm a nationally certified school psychologist, school psychology specialist at the state of Arkansas, and a trainer of school psychology at Arkansas State University. I live in Jonesboro, Arkansas, and I'm reaching out to the senators for Arkansas, Bozeman and Cotton, and Congressional Representative Crawford for the 1st Congressional District where I live in Arkansas. Also, I'm reaching out to State Representatives Sullivan and State Senator Cooper for both in Jonesboro. School psychology is a field that aims to identify and break down barriers that school-age students have to getting the best education that they can. Our overall goal is to ensure that all students have access to a high-quality public education. In Arkansas, the specific license that someone with a specialist level degree in school psychology would hold is currently called a school psychology specialist. The training and the aim of the school psychology specialist in Arkansas is comprehensive. That the barriers that we are identifying and knocking down may be in academics, mental health, in school safety, and positive behavior, or many other areas. This leads us to working not only with assessment for disabilities, but also in intervention and consultation, with collaborating with educators, families, communities, and other professionals addressing the needs of children and youth. 1 in 5 children and youth will experience a mental health disorder, and approximately 80% of students who need mental health care do not receive it. Many of those that do access their services at schools, where they're more likely to ask for help. Unfortunately, there is currently a significant shortage of school psychologists and school mental health professionals across the country. These shortages lead to unmet needs across the country, especially in rural and low-income areas. According to the most recent data from the CDC, 15.8% of 9th through 12th grade students in Arkansas reported attempting suicide 1 or more times in the past year. This is well above the national median and is a serious concern for families and educators. This is a public health crisis. Given the new challenges in public health with the COVID-19 pandemic, children and youth of Arkansas will need to be supported with access to the comprehensive services that a school psychology specialist can provide. I encourage you as a leader and my voting representative to support the mental health and safe school learning environments and access to comprehensive services from a highly trained school psychology specialist that our children and youth need, not only to survive in schools, but to thrive. Thank you.